Proposed legislation now before Governor Kathy Hochul that, if signed, would change the mandatory overtime rules for nurses. As we hear now from Natalie Kutchko, that would also apply to home health aides who say the move would boost morale across the industry. Natalie.
Adam, the bills recently passed by the state legislature are now awaiting the governor's approval. And if approved, those in health care tell us it would provide protection for an already stretched workforce. Multiple bills are pending Governor Hochul's signature in Albany that would ultimately protect and limit the number of hours nurses in New York can work. If approved, the legislation would impose a fine for employers who violate mandatory overtime restrictions. Mark Donahue treats patients at home and in the past has worked in settings that have dealt with the mandates.
Some of the aides that I used to work with would get upset with the fact that they had been mandated, and I really felt that it really affected morale in a negative way quite a bit. They have families too, and that they had now all of a sudden they had to make adjustments at home and made it extremely difficult for taking care of their families.
A spokesperson with the New York State Nurses Association addressed their insistence on the governor to approve the legislation, releasing a statement saying in part, quote, "Nurses need protection from abusive mandatory overtime. The abuse of mandatory overtime is contributing to exhaustion, burnout, and nurses leaving the profession. When nurses are pushed to work long hours, it is unsafe for them and their patients," end quote.
As far as other nurses are concerned or aides are concerned, I think it's a step in the right direction to increase morale and better quality of care and general business practice. We've already been through one wave of mandates for the vaccinations and everything else. It's been what more can you ask of the people that are caring for our most vulnerable population?
A spokesperson for Governor Hochul's office tells News 8 the legislation is currently under her review at this time. Adam?
All right, Natalie, thank you. And thinking there may be some concerns over these changes and their impact on staffing, we did reach out to our local hospital systems, URMC and Rochester Regional Health, but they did not provide comment for this report. If they do, we'll update this story on air and over at rochesterfirst.com.